purpose of this video is to discuss what is aphasia. The idea or concept of aphasia is a quite complex thing to understand. The idea of a language impairment that is greater than any cognitive impairment that may occur is sometimes difficult to conceptualize. For the purposes of this class, we are going to use a classic definition of aphasia. This classic definition was first discussed by Darley in 1982, and this definition has stood the test of time. Many people today follow this definition of aphasia, and while in the future you may hear others, for the purposes of this class, this will be the definition of aphasia that we use. Any other definitions that you might read in the literature or that you might read in your textbook should be taken as informative, but in the end, this is the definition that we are going to use to drive our differential diagnosis and to drive our discussion of what aphasia is. So I want to start out by discussing this definition. Aphasia is an impairment as the result of brain damage of the capacity for interpretation and formulation of language symbols. So I want to go back now and take that piece apart. Aphasia is an impairment as the result of brain damage. This is to set it apart from any type of developmental language issue that an individual may have. When this definition was put together in 1982, the word aphasia was sometimes used to describe specific language impairment or other language impairments in children, and the term childhood aphasia was often used to describe language impairment in children. In 1982, Darley wanted to set apart the language impairment that we see in individuals who have acquired a loss of language as the result of brain damage from any kind of developmental issue that might be seen in children. Sometimes I'm asked about childhood aphasia. There's actually very little literature on childhood aphasia as it is described as an acquired brain injury. There is some older literature that discusses childhood aphasia as if it were a language impairment or specific language impairment in children. However, those terms are really no longer used. So this first part of the definition, impairment as a result of brain damage, is meant to set apart developmental language impairment from that which is acquired. Let's continue. Aphasia is an impairment as the result of brain damage of the capacity for. This is important. This part of the definition identifies that the difficulty is not a complete loss of the ability to use language, but rather a decrease in capacity for the processing of language. So the definition says impairment as the result of brain damage, not developmental, of the capacity for, not necessarily a complete loss, interpretation and formulation of language symbols. This is a really key part of the definition of aphasia as Darley presented it. This is considered an and definition of aphasia. You'll see that the word and appears between interpretation and formulation. This is because Darley and many modern aphasiologists see aphasia not as an impairment in interpretation or formulation, but the fact that all language processes, interpretation and formulation, are impaired. Okay? Remember back to the Whitman model that we discussed. The idea that in the center of the model is the language integrator, which both integrates what is brought in from the outside world and what is formulated to be sent out into the outside world. Therefore, it is a unimodal, right? It's one area with that goes across the modes of language and therefore fits nicely into Darley's definition. The reason we initially talked about Whitman as a model of what language is because it was Whitman's model that drove Darley to this definition, and why the word "and" appears. Because the information in the integrator in Whitman's model is both what is interpreted and what will be formulated in terms of language, this model fits nicely with Darley's definition. So it is an impairment as a result of brain damage, not developmental, of the capacity for, not a complete loss, but a decrease in capacity, interpretation and formulation of language symbols. Anything that is symbolic, that is, a symbol is something, one thing that stands for another, is going to be affected in aphasia. This is an important idea. If we go back to early attempts to use augmentative and alternative communication or sign language with individuals with aphasia, we find that those attempts are often not successful when highly symbolic material is used. So for example, in the case of traditional AAC grids, where a particular picture symbolizes a particular piece of language, individuals with aphasia often struggle with that. They struggle with it because it is exactly the attachment of meaning to the symbol that is the problem in aphasia. The same would be true of trying to teach someone with aphasia to use sign language. A person who had a difficulty assigning a symbol to meaning would also have a difficult time assigning a sign to meaning. Therefore, aphasia is going to affect the use of symbols. That means it's also going to affect the use of things like symbolic gestures. It's going to affect things like the symbolic use of writing or drawing. So even with individuals who have the motor ability to do some drawing or to do some gesturing, it's often the case that the creations that they make are not very symbolic. And while they understand some of the nonverbal skills, because the right hemisphere is often relatively intact if we just have aphasia and not a situation where we have both hemispheres involved, we will see that individuals will have a difficult time interpreting even complex symbolic drawings and complex symbolic gestures. So we're going to start over. Impairment as the result of brain damage, not developmental, of the capacity for, not a complete loss, interpretation and formulation, that is both expressive and receptive, use of language symbols, all kinds of symbols, seeing symbols being one thing that stands for another. When we think about words, words are highly symbolic. A word stands for an idea. Therefore, the use of words will be highly affected in aphasia. They'll have difficulty expressing words, they'll have difficulty understanding words, both understanding words they hear and understanding words they read, because it crosses modalities, and words they want to say and words they want to write. It is a multimodality loss. That means it crosses the modes of language. That means reading, writing, speaking, and auditory comprehension. I sometimes say those as reading, writing, speaking, and listening to make it easier for you to think about the ings, right? Reading, writing, speaking, and listening. But that listening really is about the auditory comprehension component. So, aphasia will be a multimodality loss or reduction in efficiency. Okay, so again, it's going to be a multimodality loss, or it may just be a reduction in efficiency in milder cases. So in other words, there isn't a loss of the ability, but it takes longer, it's less efficient. Okay, in the ability to decode and encode. Again, this is receptive and expressive. The term "and" is used in this definition because both receptive and expressive language are impaired. What this means is a multimodality loss will include deficits of some kind in all the modes of language. You will see some deficits in speaking, some deficits in writing, some deficits in reading, and some deficits in listening or auditory comprehension. Those deficits may be more or less in each of those modes. For example, more speaking deficits than auditory comprehension deficits, or more writing deficits than reading deficits. But there will be some impairment in all 4 modes of language if this is aphasia. This is the definition that we are going to use to help us differentially diagnose aphasia then from apraxia of speech, dysarthria, alexia, agraphia, and other kinds of acquired brain injuries that will affect only a single mode or may be in combination with one another. So for example, one might have a apraxia of speech and an alexia, which is a decrease in reading, if only those 2 modes, speech and reading, were affected, but there were no deficit in auditory comprehension and writing, we would know we did not have an aphasia because not all 4 modes are affected. This is essential in differentially diagnosing the various types of language and I'm going to call them language-looking deficits that can occur after brain injury. In aphasia, we will see all 4 modes affected. So it is a loss or reduction in efficiency of the ability to decode and encode conventional, meaningful, linguistic elements. This is another way of saying that this affects language and that this is going to affect symbols, but not just concrete symbols, all kinds of linguistic elements such as morphemes and larger syntactical units. These deficits then will be disproportionate to any impairment of other intellectual functions. The National Aphasia Association says that aphasia is loss of language, not loss of intellect. And that's true because of this statement that the deficit in language is disproportionate to any deficit in cognition or intellectual functions. When we talk about the cognitive functions or intellectual functions, we're talking about things like attention, memory, problem solving and reasoning, the underlying conceptual schemata or propositions, and executive functions. This definition does not say that they're not present, as the National Aphasia Association says, loss of language, not intellect. There is some evidence that in many people with aphasia, there is some reduction in some of the intellectual cognitive functions, but that they are a result of the language impairment and that they are disproportionately small to the language impairment. This idea of aphasia is not attributed to a dementia, confusion, sensory loss, so it's not because you can't hear or because you can't see, motor dysfunction, dysarthria or apraxia, and is manifested or is seen in or is most noted in a reduced availability of vocabulary, a reduced efficiency in the application of syntactic rules. We see agrammatism, absent grammar, and paragrammatism, grammar that looks right but isn't quite right, and reduced auditory retention span, and impaired efficiency in input and output channel selection. So in summary, this definition is quite comprehensive and it's actually quite complex. As we approach these topics, I want you to keep thinking about this definition of aphasia and keep it as the forefront of what you think about as you consider diagnosis and treatment of people with aphasia.